This is part 2 of Psychology 6506, Abnormal Psychology. So let's talk today about what is abnormal psychology. Well, it started as a branch of medicine. It's essentially studying psychopathology, something that's sometimes called mental illness. Now, a brief history of abnormal psychology. Hippocrates is thought of as the father of modern medicine, and he came up with a theory saying that there are 4 different personality types and they're caused by 4 different bodily humors. So he had a biological explanation for behavior. Now you see throughout history, abnormal psychology alternates from an enlightened view to a view of fear and suppression. So in the Middle Ages, mental illness was looked at as caused by demons and possession. In the Renaissance, there was a movement toward asylums and humane treatment. And in the 19th century, moral treatment, the idea that mentally ill persons needed to be treated humanely, came about. It saw its rise and decline in the 19th century because eventually they got overcrowded asylums, and again, people who were mentally ill were mistreated. Then in the 20th century, the biological and the psychological perspectives came about, and that's the way we view mental illness now. Now, throughout history, both scientific and economic factors have affected the treatment of the mentally ill, and it's no different today. Right now, California is having a budget crisis, and you'll notice that some of the first things to be cut are treatment for the mentally ill because it's a vulnerable population. Current trends in mental illness, the biological and the medical model is predominant. That came about mostly because of economic factors, and it's ironic because we have never been more knowledgeable about the psychological treatment of mental illness. There are specific and effective psychological treatments, but because of economic factors, a lot of times someone who is having emotional problems will go to their primary care physician, get an antidepressant or another sort of medication, and never see a psychotherapist. And also because of funding issues and economic issues, there are ongoing turf battles as mental health professionals struggle over limited funding. So it used to be that mental illness was treated exclusively by persons with doctoral degrees. Now there are many master-level therapists, which is a good and a bad thing. It's good to expand the available professionals. It's bad for people with doctorates because it makes it difficult to compete. So these are some of the issues that we're dealing with in the field of abnormal psychology, and that concludes this lecture.